This video will describe the second interprofessional oral health core clinical domain, oral health evaluation. According to HRSA's Integration of Oral Health and Primary Care Practice document, shown here to the right and linked at the bottom of the slide, Domain 2, Oral Health Evaluation, integrates subjective and objective findings based on completion of a focused oral health history, risk assessment, and performance of a clinical oral screening. The competencies for primary care providers in this domain are to perform oral health evaluations linking patient history, risk assessment, and clinical presentation, identify and prioritize strategies to prevent or mitigate risk impact for oral and systemic diseases, and to stratify interventions in accordance with evaluation findings. This slide shows a screenshot from Smiles for Life Course 5. You'll learn the systematic approach to conducting an in-the-mouth oral health screening as part of this course. Some things to consider with your project team as you're developing your systems. Consideration number 1, at what prenatal visit will oral health screenings occur? To start, as with risk assessment, only select one prenatal visit. You can scale up and add additional visits later to repeat oral health screening with your pregnant patients if you so choose. Again, it is recommended for oral health screenings to occur early in a woman's pregnancy. Identifying a specific prenatal visit to integrate oral health screenings will help with consistency across team members and will ensure that data can be collected more efficiently. Consideration number 2, which provider or providers will conduct oral health screenings? Consideration number 3, will a specific tool be used or developed? Consideration 4, what supplies will be needed? For example, a light, mirror, gloves, tongue depressor. In consideration number 5, how will oral health screening findings be documented in the EMR? How will you track and report how many screenings were completed each month? And now for some oral health evaluation examples. Starting again with the National Consensus Statement. The consensus statement states that primary care providers should check the mouth for problems such as swollen or bleeding gums, untreated dental decay, or a tooth with a cavity, mucosal lesions, signs of infection, or trauma. The American Academy of Pediatrics Protect Tiny Teeth Prenatal Oral Health Screening Guide, is shown here and as part of Domain 1 video, includes step number 2, to examine the patient's mouth for problems to see if treatment is needed. Check for swollen or bleeding gums, tooth decay, and signs of infection. Some examples of common conditions like these are shown on the back of this card. As you can see on the right, it includes photos and descriptions of oral conditions that may present during pregnancy. So this on the right here would typically be on the back of this prenatal oral health screening guide as a resource for providers. As part of the Partnership for Integrating Oral Health Care into Primary Care project, the Maryland project team developed this screening checklist for their nurse midwives to document oral screening findings. The photos to the right were laminated and placed in exam rooms as a resource for providers. And now documentation in the EMR. The next 2 slides share examples of documentation of oral health evaluation using structured data fields within certain EMRs. This example shows how oral screening findings could be documented as part of the physical exam in Athena, such as tooth decay, bleeding, gingival swelling in areas of the oral cavity, such as the oral mucosa and throat. And this final template from Centricity, as also shown during Domain 1 video, includes all domains except Domain 3, preventive interventions, as well as a population of interest section that includes categories for hypertension, diabetes, age, and pregnancy trimester. So everything's in one place on this template in this Centricity EMR template. And finally, the project measure for this domain. The description is percentage of pregnant women who received an oral health screening during a first or second trimester visit by a primary care team member. The denominator is the total pregnant women seen for a specific visit as identified by your project team during the month. The numerator is the total pregnant women with a documented oral health screening during a insert your specific visit decided upon by your project team by a primary care team member during the month.